Seen well? Am I
Ma'am,
audible?
please start.
Thank you. Good afternoon, everyone. On behalf of Quality Assurance Unit, Medical Education Unit of PIMSR Parul University, I, Dr. Pooja Dillu, moderator for the session, thank you all for being part of today's webinar. Series Session 8, titled Exploring the Scope of Educational Research and Evaluation for Curriculum Development in India. We thank Dr. Amol Dongre, sir, to accept our invitation as an expert speaker for the session. Dr. Dongre is a professor of community medicine at Sri Manakula Vinayagar Medical College and Hospital, Pondicherry. As a graduate and completed his post-graduation in community medicine from MGIMS Sevagram and earned his master's in population science for International Institute for Population Science, Mumbai. As an international fellow in medical education in 2015 and obtained a master's in health professional education from Keele University, London, UK. He has conducted over 200 national 5 days workshops on qualitative research methods and an equal number of online workshops for qualitative and mixed method research. He is author of book on qualitative research methods, 7 book chapters, and has more than 160 publications, which include 45 international and 120 national publications. His research interest includes maternal and child health, aging, educational research, and innovation in medical research methodology. I'm really thankful to have Dr. Amol here. We started in Parul University this year, the qualitative research work by Dr. Amol. It was an on-site workshop, and I'm really thankful to him for accepting the topic at the end of this year in 2025, and looking forward for more collaboration with him. Thank you so much, sir, and welcome for starting up this session and to be with us.
Thank you, Dr. Pooja, for your invitation and a nice introduction. This webinar, I'm going to talk about exploring the scope of educational research and evaluation for curriculum development in India. What I'm going to do is, first I'm going to focus on understanding the nature of education system and what is the nature of evidence, and we'll be focusing more on complexity model here, and we'll draw some examples from it. And then what are the suitable designs to carry out educational research and educational evaluations. Then we'll have some quick look at current status and what are we doing, and then we also towards the end see what we should be doing next to improve the rigor in educational research and evaluation. So initial few slides will clarify the concept of complexity model and then its relevance to the current situation, particularly when we are experiencing implementation of CBME curriculum in India. In that context, I'll try to bring some examples on that. If you are educational researcher, then we always have, then you will always experience this question. You will always see one thing common, that why are robust impact evaluations are rare. That holds true even in public health, but holds true for educational research. Then second question that we need to reflect is why there is little evidence for most of the things that we do in education. Now, that's quite important question we face. And then even after we know a lot in whatever particular area we practice, we face problems in bringing it in practice that increases the theory practice gap. And then the third question, which I always face and you also must be experiencing, is that there is no program which is entirely successful or a complete failure, and perhaps till infinity, there won't be any program which will be 100% successful or 100% failure. And then the last question that we need to reflect is, why does every intervention that we have in field of education bring both benefits and collateral damage with it? So no intervention is free from collateral damage along with the benefits that we get for it. So does this mean that we manage it badly or we misunderstood it? Now let's look at it as we progress further. I don't take any stand on it, but we certainly need to reflect on this question. So before I progress further on complexity model, let me focus on the learning ecology. We know that the learning ecology is quite complex. There are different stakeholders ranging from students, teachers, administrators, parents, community expectations, media, the technology, and they all interact with each other in some in certain way. So these multiple stakeholders make this system complex. But is that enough to make it complex, or is there something else we also need to consider along with it? We'll see that. So let me focus on the type of systems before I actually take it to that complexity model. The first type of system, we call it as a simple system where the cause and effect relationship is straightforward. For example, you switch on the button, the fan, and the light is on. This we call it as a simple system where cause and effect relationship is direct, is well established, and there is no alternative explanation. The circuit is complete, and that's why the thing worked. There is another system, we call it as complicated system. Now, this type of system, if they have more parts and if certain steps are followed, then you tend to get that desired outcome more or less in the same way as you had expected, like construction of bridge, the rocket launch. They all are complicated system. Now, the third type of system that we have, we call it as the complex system, where it mainly deals with humans, their behaviors, and human beings are highly networked. And so any interventions that you do on them will have some different outcome than you anticipated. And this we call it as the complex system. We'll see more details of it as we go further. But then certainly the educational matters are not simple and complicated always. They tend to be more complex in nature. So let me be a little more technical here to tell about the various components of complexity model, and then we'll see it in the context of education. And that explains many of the questions that we always face or are going to face in the future. First component of complexity model is agent. Agent means is here the different stakeholders that we have. And so the first question that we ask, who is the intended audience? And are the agents able to make decisions? Second, we say, what are the attractions for the behaviors? And why are the clients seeking that particular service from that particular system? Third is self-organization. What motivates clients to continue or complete the services? Fourth component is boundaries. Those who are part of that complex system are often governed by some set of rules and behaviors. We have feedbacks which actually shapes the behavior in those systems. And so we have to ask next question in complex system, that do program consider client feedback to restructure services? And does the program staff use the client's strengths, needs, abilities, and preferences? And the last one, a very important one, as a result of all this, what we get is the emergent behavior. And it's a product of all that dissonance or the interaction which was going on that complex system. So the question that we ask here, are the clients with similar behavior grouping together, and do client behavior reflect any pattern? That's what we call it as emergent behavior. Now, just to keep one thing in mind, we have one good news and one bad news here. One is that small change can affect all components of ecosystem, and small change can bring big effect. That may be positive and that may be negative. Now, that we can know whether the result is positive or negative only after its implementation, at least in the pilot setting. Now, if we see it from the we take an example of NEAT as a complex adaptive system. In that, if we see that, then let's apply each of this component, complexity component, one by one. The first, we have agents like student, teachers, parents, coaching centers, university, and all make independent decisions, though they might be influenced with each other, but they are free to take the decisions. Second, what attract the students to go for this course? Perhaps the medical career, the glamour, the social status, and job security. And so how do they self-organize? There are peer groups, there are online forums, the coaching centers, the universities, they may have their mentors, and they all organize themselves. So this is entirely a social organization. Now, let me focus a little bit more on the agents. They are macro, meso, and micro. So at macro level, you have regulators, accreditors, and societal expectations. At meso level, you have medical colleges, faculty, coaching industry, and hospitals. And at micro level, you have students, parents, mentors, teachers, and peers. So when we are planning any research, we have to keep in mind where are we focusing, and we have to also be mindful that they are all interlinked with each other in that way. Let's continue with the remaining components. That in that ecosystem which I just mentioned, there are some boundaries like eligibility rules for NEET exam, the exam syllabus, the time limits, then there are feedbacks going to the system by the behaviors. But keep in mind the emergent behavior, what was anticipated, that we expect a uniform study pattern or at least the uniform admission policy. But the byproduct along with that would come like competitive stress and coaching hub culture, which is shifting education from colleges to the coaching centers. That was never anticipated. That started happening. And why is that happening? It's because of we are doing intervention on complex system, and such kinds of unpredicted outcomes is a very nature of this complex system. So I equate this complex system with Sagar Manthan, where if you churn the ocean, in Sagar Manthan you got both nectar and poison. So same in complex system like education, and I would even say the public health. When you do interventions on people, this as the system is complex in nature, it's going to give you both in return. So when we plan any research or study, we have to keep those both outcomes in mind when we want to capture in a holistic way. So there is an argument on the proposition on the nature of evidence published already. So they say that there is multiple forms of evidence in education. Predominantly, it's qual in nature. You can measure some of the smart variables with quantitative data collection, and you can study complexity better with the mixed methods. These evidences are more context dependent, so something which works in one college may not work in other, exactly not in the same way, but there needs a contextual modifications for that. Then there are going to be non-linear and unpredictable outcomes. So something which worked for you, if I try it, I might end up having some other outcomes as well when I implement it. So small change can give you a big ripple effect. The emergent behaviors are the key and they keep evolving, so they are not stable and constant. So, what we are doing, intervening, is something very fluid in nature when we deal with any behavior change on complex education system. They are mainly pattern and they are relationship oriented. They are more iterative and adaptive in nature. So, having said that, so something which is so fluid in nature can be best studied with some different kind of methods. So we have to think of those when we go for it. It's because of this complex system, there is going to be some messiness in it. There's going to be a lot of ambiguities, dissonance, and frustration always echoing. So you'll see a lot of overlapping and confusing terms. There are plenty of technical jargons. There are lots of fashions and fads, and there are dominant perspectives which drives the decision rather than the evidence, because the evidence is tough to get, and if you get it, then its interpretation is even more difficult. And quite often there is a risk of losing purpose of doing that educational activities in an effort to master the technical jargons. Particularly with the novice researchers, they get lost with it and they take that as an ultimate truth, which actually does not exist in social science, which keeps taking different shapes with different times and with different stakeholders. So we get two insights from it. First one, do we research or evaluation? Do we do research and evaluation in educational matters as if it is simple or merely complicated? Yes, that's mostly happens. Second, that we experience is the dissonance that we experience with every new intervention as a result of inherently complex nature of education. So is that dissonance that we experience is the very nature of it? And yes, that's going to be the very nature of it. So if that's the nature of education, if that is so unpredictable, non-linear, and more fluid in nature, what kind of designs are appropriate here? So I won't be elaborating here on the quantitative and qualitative methods or mixed methods, but I'm just going to put that in one table form. But before that, let me put how the typical research question would look in on complex system. So if we take one example, and if we want to do a research on the same scenario which I had mentioned, and perhaps we can have this kind of research question, that how do the interaction between students, coaching classes, exams, and the university policies around PGNet or the regulators policy around PGNet affect CBME implementation in medical colleges? Quite broad question, and it needs to be broad, and then you can measure its subcomponents so that you can give a holistic picture of how these stakeholders interact. Now, if we want to do the evaluation, what's the impact of this PG need driven environment on the effective implementation of CBME curriculum, particularly on teaching practices, student learning, and assessment approaches, for which we most of us have concerns? So can we study this in a holistic way using a complexity model where we don't want to put any blame game or find faults, but to understand that whole system and think of a way that how we can make it better than what we are? We can only minimize the negative outcomes. We cannot remove it completely because emergent behaviors are unpredictable. What will come out, we don't know, so that we have to learn with the implementation cycle. So what designs are then appropriate for problems in complex design? So I'll just put one table here and we'll tell you that for quantitative, keeping the complexity components in mind, we need research, which simple descriptive statistics are important. We need that. To understand attraction in quantitative, you can think of using autocorrelation, and in qualitative we need multidimensional scaling, and hierarchical cluster analysis. For understanding heterogeneity, we can use a Bayesian decision tree for quantitative and ethnographic decision modeling and framework analysis of themes in qualitative. For dynamic use of feedbacks, we can think of using survival analysis in quantitative and network analysis in qual. And for understanding self-organization, we might use a structural equation modeling and cluster in quantitative and cluster analysis for qualitative. So for understanding emergent behavior, we may need a special analysis in quantitative and pathway modeling in qualitative. Perhaps there are many more options than what I have listed here, but we need little more sophisticated and deeper and diverse data to understand the complexity and how what is the interactions and the outcomes of those interactions of the stakeholders. So then in simpler way, if I'm asked to put that in one single slide, but not in the table form, then I would put it this way, that there is always already an argument saying that we need a design-based research which harness mixed methods along with change management. So that's the AME guide number 60, which talks about it. So that kind of designs are appropriate where we have to have an iterative cycles of designing, implementing, testing, refining the intervention in real world settings with the practitioners' involvement, a typical language of participatory action research, which we practice in public health. Now we also need that to practice in educational research. But there are principles and discoveries of PRA that we have to consider. If you see AMA guide number 60, that has taken care of this aspect very well, that how we can use the results for making change subsequently. What we don't see is the a longitudinal quantitative and qualitative data collection, which is needed for understanding the issues in complex system, because they are adaptive, they are and they always have an emergent behavior which can be best captured with longitudinal design, and cross-sectional designs may give an illusionary picture of its success or failure. And also the pure qualitative research to explain the phenomena of interest in the context where we are practicing medicine. And then mixed methods, that's quite popular. But now the movement is going towards understanding the complexity, because mixed methods can just focus on few variables. And the argument here is that we just cannot focus on few variables or few stakeholders, but to get a comprehensive picture, we may need to focus multiple stakeholders for that research to be holistic. We know the definition of research and evaluation in education, and we need a balance of both. We need good research and we need evaluation. So research is typically done to get the new finding for more generalization, and evaluations are done to check whether the program is working or not, and if yes, in what way, and if not, why not. So the evaluation findings are going to be more context specific, and research mainly aspires for generalizability. But looking at that, if we quickly look at the current status, so it's actually not a very current status, a bit old for the time now, but we did this exercise long ago, and we found that there is an increase in trend in research. We reviewed some 71 articles published in one reference period to check what's the trend in India on educational research. And so we just used one database here. That can be methodological limitation here. But the trend talks about that there is increase in number of publications. So that's a good news that medical educators are taking interest in that. So then who is the target group? The most of the research is targeted for on medical undergraduates, and very little on internship, post graduation, and faculty development. So which departments are taking lead on it? Mostly the physiology, community medicine, even the pharmacology. They have a lead taken on these aspects. And what kind of research is happening on that? They are mainly Kirkpatrick level 1, the satisfaction kinds of surveys among undergraduates. And mostly employed method was quantitative research methods. And they're mostly single site studies. They are led by the private institutes and they are mainly published in the specialty journals, and negligible proportion of the studies are funded. So they are initiatives by the researchers. And so what topic do we study? It's about some of the surveys, small group teaching, large group teaching, the faculty development programs. And so that means that all curricular components are not studied. And then the ecosystem has everything that undergraduates, postgraduate, interns, faculties, and they all have their own outcomes to achieve when they are there in that system. We had another scoping review in 2022 during COVID times. What kind of publications happened during the COVID times? The trend is more or less similar, so that validates the previous exposure, the previous findings. So what we draw from it, that mostly they are evaluations, not research, and they are Kirkpatrick level 1 or some Kirkpatrick level 2, because that's the only feasible thing for faculties to do. Because in absence of funding, support, and appreciation, what work they are doing is really an heroic task that needs to be appreciated. So here we are not criticizing, here we are just analyzing the situation. And the most of the research that happened was on the teaching learning methods, where that seemed to be the most feasible, and among undergraduates, perhaps the most accessible target population for them to study, single site and mostly self-funded. So that's the status that we have. And there are some common concerns apart from this we always hear. We see the gap between the curriculum that we have and what we practice on ground. And most educational research that we have just said that are on level 1 and on teaching learning methods on among medical undergraduates. And there is a risk of different response or outcome to same intervention. So you will see some papers coming, those papers talk about both the things. Because of mixed methods, now we get both kinds of facilitators and barriers to see in its implementation, but we have to go beyond that as well, and increase the complexity of our designs to capture the diverse perspectives. Quite often, there are no end users of our results. The paper get published, and there's very limited uptake of that evidence that is generated, or I would say not generated, constructed, because it's more of constructivist in nature. And quite often there's limited description of context, or transferability is an issue, and most of these works are written with the technical jargons that improves the theory practice gap. And sometimes the practitioners lack time to read the results and doubt if it's going to help them in the real world practice. So there is a culture of researchers in institute. In every institute, you will see there is a culture of researchers and there is a culture of practitioners. And so we need a synergy between these two to bring more practice-oriented research question and to bridge the gap between theory and practice, at least at the institute level. So towards the end, I would say that complex systems are misunderstood due to lack of complexity literacy. So we need to embrace this very nature of complexity in the faculty development program as a part of curriculum development, its implementation and change management thereafter. And that should be the part of faculty development program and the culture in the education and evaluation culture in the field of education. We have to, it's easy to go with the linear thinking, but we have to be aware that we are practicing linear thinking on non-linear system. So that also we have to be aware of. And that's why there is a risk of overestimation on how much we can control. And there is also a culture of penalizing the emergent behavior instead of learning from it. We have to acknowledge and learn from it how we can take it further. So, what can be done? We need to embrace diversity and local adaptation. So, for that, we need to improve complexity literacy right from macro, meso to micro level. At least at the macro and meso level, this literacy is critical. Conducting small scale pilot and using a right design is better. uh, be aware of the emergent patterns. So instead of getting panicking about any negative outcome that comes, we can learn from it. We need to foster trust networks as change flows through human connections, not regulations in complex education system here. And use stakeholders co-design before introducing large policies. So if you see that, so many large scale projects nowadays are talking about co-designing the intervention. So not planning in isolation and prescribing it top down, but to have a horizontal communication of co-designing and accommodating the concerns of the practitioners and the, I would say, the frontline teachers um, in this matter. So there is always a sense, response, and adapt kind of cycle happening here. So every time we do educational research or evaluation, we have to be aware of this system. And this, what I'm sharing, is a product of my recent reading and reflection. So I too was thinking quite linearly on many of the aspects in educational matters. But since I believe and practice participatory action research, where we keep in mind the concerns of various stakeholders, at least we say that should be done. The same, I think, practice needs to be brought in the education sector as well from that. And there is enough argument by the experts already done in the field. So that's as such quite not very novel, but putting that in perspective in today's webinar is new and important for us to reflect. What we look forward is that we need more funding for complex studying complex problem, because they can't be studied with the cross sections with money in your pocket, but they can be studied longitudinally with multicentric efforts. So they need funding. They need to be multicentric and longitudinal in nature. Should be the part of faculty empowerment on complexity design. So faculty development programs talking about research and evaluation needs to uh, go beyond mixed methods and start talking about these frameworks as well, these designs as well. So in addition to the complexity, we also need to be aware of change management strategies required on the complex system, because they are more political and emotionally disturbing. So managing change is tough on this. So as you try to correct one thing, the other thing starts collapsing. So all that requires a very careful balance. And there is a culture in participatory research that develop a soft system which are flexible and which adapts with time. And also finally, I would go a little beyond and say that we need a dedicated journal for educational research and evaluation. That's coming from the findings that we had just mentioned. So thank you very much for your patient listening. I would extend my thank to the entire team of Quality Assurance Unit at Parul University. Thanks to Dr. Pooja for making it sure that this webinar happens. And thanks to Dr. Neeraj on personal ground for supporting this webinar. So would like to hear your question and reflection. However, I do not guarantee that I will have answers to all the questions, but would certainly like to mm, uh, hear your reflections and thoughts on this. Thank you very much.
Thank you so much, sir. Uh, before I start opening up my question list, I would like attendees to raise their hand. Okay, Kadambari madam is here. Ma'am, you can unmute yourself. Kadambari ma'am, kindly unmute yourself.
Uh, Hello, Dr. Pooja. Am I audible?
Yeah, hello ma'am and welcome. Really nice to see you.
Yeah, same here. Thank you.
Thank you.
Dr. Amol, it was wonderful listening to you as always, and there's always so much learning that we get listening to you.
Right.
I just have, when we talk about curriculum development and trying to link curriculum development with research on complexity, using complexity designs because education is a complex. That part is very clear. But when we do, when we take up this as a research project, how would we actually go about it? Longitudinal, multicentric makes sense, but what would be the would we be doing multiple small projects, or would we be doing
That.
a huge thing which will be bring in many interventions which will make it even more complex? And so I'm trying to visualize what will
Right.
be. Yeah.
Right. That's a good question. But I would just anticipate and answer that question. There is a place, a thing called formative evaluation, which we can continuously do over the curriculum and make the incremental improvements in the context. So instead of conceiving the research project, a one-time research project, can we think of doing a longitudinal formative evaluation on the curriculum and learn the lessons from it and adapt to the newer expectations? That's how I would see at it. Any other thoughts on it? I would like to hear that.
Yeah, actually, that makes sense because any of these, like as you very rightly pointed out, there are so many stakeholders, and the emerging behaviors among these stakeholders keeps varying over time, and that adds to things. You can never have a curriculum designed forever, and as you
Yes.
said, formative evaluation, and probably as you go on you have to keep making several iterations. Yeah, thanks, that makes sense. Thank you.
Thank you, madam. Thank you.
Thank you, ma'am. Thank you so much. Kindly raise your hand so that I can unmute you for this. Okay. There are no questions, but yes, Gitanjali madam has specified superb talk, Amol. Enjoyed it very much. I liked your very tempered view of the topic, and Dr. Ghosh has specified. Thanks, Dr. Amol, for the wonderful talk with a great insight. Thank you, everyone. There's one hand raised. Yeah, Anshu madam. Anshu ma'am, please unmute yourself.
Yeah. Thank you, Amol. And as expected of you, your talk has been fantastic. And you always make us think, which is the reason why I have uh, forced a lot of postgraduates to attend this talk. And I hope they are there here today from Sevagram. And I love the fact that you introduced complexity. But and my question was exactly what Dr. Kadambari asked. So I would like to go a step ahead and ask you. In the beginning, you warned us and scared us by saying that every kind of research leads to some kind of collateral damage. So,
Okay.
what what is your advice to small researchers like me? If I'm sitting in my department, I'm sitting in my institution, and if I need to do something, where do I start? Uh, how do I go ahead knowing that research in education is complex and probably not transferable at all, not generalizable
Yes,
at all?
yes, yes.
So
Um,
your advice, because most of the articles that we see and your analysis has been excellent with Dr. Deshmukh, is sorry to say not worth the price of the paper they were published on. You can't do anything with the educational research which is coming out of India.
mm,
So, what are the methods and modalities that we need to do to strengthen the kind of research so that it makes an impact on actual practice?
So the first question is that there is no need to be worried or having fear about it, because I just equated it with Sagar Manthan, that every time you churn the ocean, you churn the ocean of complexity, you are going to have both nectar and poison. You can only maximize nectar and minimize poison. That's what I understand. And with my practice of using participatory action research in community settings, I have seen that you go with the very well planned intervention with the altruistic motives to benefit people, and you implement it. And when it starts giving you the result that you envisioned, but it also starts bringing some other things which you never anticipated. We have to just learn from it, keep documented, and we just minimize it and learn from it. That's the only thing I can say. And second is about in future, I think when we do research training, we shouldn't be just talking about quantitative methods, qualitative methods, or mixed method. We should start talking about using them in an integrated fashion along with change management, so that the evidence that we generate is not only for publication in high impact factor journal, but they are for bringing about change in the context as well. So that is how I would see at it. Hope I have answered your question.
Yes, largely.
Yeah,
Thank you so much.
thank you.
Thank you, Anshu ma'am. This was one of the question in my list, which ma'am has specifically asked. Like there's one question on the chat box. Dr. Amol, you can have that on the wonderful and informative session, sir. Can't the NMC and Health University consider reserving a mandatory fund for program evaluation once a new initiative like CBME in MBBS or PG is rolled out?
Look forward to.
And in continuation, they've asked a longitudinal and periodic evaluation mechanism could provide valuable feedback for course correction and evidence-based implementation.
That's important. We don't get donors. I'm currently doing my PhD. I have written letters for more than dozen donors. Nobody accepted or liked the idea, perhaps. So there are no donors for it. But particularly when you say you are doing a research, you are building a theory, you are planning to do something, nobody find it exciting. I look forward that culture changes and we start valuing the research, because uh, they generate the frameworks for decision making. They are quite analytically generalizable. So generalizability is also understood only in statistical terms. We have to also consider the other models of generalizability and start funding these kinds of research. So look forward that more donors will come forward, and they will not only fund the small scale studies, but the large educational multicentric studies. Look forward that happens in our country.
Thank you. Thank you so much, Dr. Amol. Till we have few more questions on the chat box or hand raised, I have one quick question. Very well said that change management should be there, whatever the research one intends to follow, specifically in terms of education. We need to look into a change, what has been identified from that, the outcome of that research. I would like to take it in a very different format. How about getting a publication of a change being promoted for a research based on the research output for any curricular aspect? Would you think that it will make a better sense and might promote having more donors to fund the research project? Because mostly, even in since you are from the public health field, so whenever any change is being identified and that is being involved in public health domain for the betterment of the community, that gives a more input for funding. So can an educational change management, maybe in a small institute, one institute, It can start, it definitely is going to start from one institute and then going to the multicentric. Can that be a possibility of getting a donors? And if so, how we can move ahead with it?
So maybe I think to manage changes which requires less funding at institutional level, I'm no one to prescribe the funding policies and all, but I think that institutes should take the responsibility for managing change at the institute levels. But the changes that happens at the larger policy levels and which affects the wider number of agents that I mentioned, which takes care of your students, teachers, parents, and the regulators and accreditors. That kind of funding responsibility should be taken by the donors for that. And the whole thing, if I connect my this what Dr. Kadambari has asked and what Anshu Madam has asked, and so how we see at curriculum. If we see at curriculum as a process, then there is no end to the formative evaluation. They will go on and on. Then there won't be a state where we will say that we have reached to the point where we don't need any more changes in the curriculum. But your students are changing with time. The newer generations are coming. The technology is arriving. So your change management as such never stops. If I understand complexity this way, then it will never stop. They will go on. And we have to continuously adapt to the newer expectations and the technological development that happens. So if we see curriculum as a product, then there is an end. But if we see curriculum as a process, then we have to continue this journey on
So
that.
I believe that we can take it both ways, process as well as product. It depends what exactly the research question is.
Mm. And from where our language is coming, that we have a very popular framework that we use, and they are simple frameworks in evaluations. We use a Kirkpatrick frameworks. That's really easy for linear thinking. That really shaped lots of educational research on that. Uh, but can we go beyond that to for complexity evaluations? The most of the research keeps asking students their satisfactions. This doesn't mean that the level 1 surveys or studies are not important. They are, of course, important because students' reaction to your interventions are primary before you test the effect of it. They
Yeah.
are important. So they should be encouraged. The reviewer should not stop publishing those kinds of studies saying that this is the Kirkpatrick level 1 study, so we don't publish them. They should be encouraged, and particularly in that context, if there is a journal, they should go for it. But then at bigger level, we need a larger multicentric studies in collaborations to understand the overall implementation at larger level. But each college and each institution should be free to innovate and improve their curriculum in the defined framework and standards that they are asked to implement or follow.
Thank you. Thank you so much. We have few questions on the chat box. I will start with the first one, Dr. Anjana. What is the most suitable design and article type for publishing a novel gamified anatomy teaching intervention, game stall plus small group handmade model creation for first year medical student? That's the first question she has asked.
Maybe I think I will share my email ID. I have to think and understand your article before I prescribe something for it. But that's a good work. You will certainly get the right journal for its publication. Maybe you can drop your email ID in the chat box and I will respond to that.
Thank you. And in continuation, she's asked, would a quasi-experimental correct factor evaluation or a mixed method descriptive approach best demonstrate impact of knowledge, engagement, and team building?
Again, very tough to say because I have to read the objectives, designs, and whole thing on it. So what you have done seems good because you are going more towards complexity analysis. You are using multi methods, and also think of involving multiple agents as you go further. So to begin with, you have to go ahead with what resources you have and what capacity data you can manage. With that, it's okay to go ahead with what you have planned.
From same Dr. Anjana, how to decide the type of study for your medical education innovation projects?
That's the first journey that we start with the problem. What is actually making you to have that study? Then, based on that problem, do you want to do a research or you have some project already going on it? Do you want to go for evaluation? And once you do that, you use a framework, whatever it is, whether it is a research or evaluation, you choose a framework. And then based on that framework, you choose the variables, think of variables, and then you decide your objectives and then you choose the methods thereafter. So there are typical research process that we follow in other field. Here we give more thought on the conceptual, give more thought on conceptual framework and the complexity analysis of that topic.
Thank you, sir. There's one positive remark. Wonderful session, sir. The approach for teaching the research in mind, taxing students, and can there be a different approach to handle it?
So maybe there's no less possibility. I got an email from Dr. Anjana here. I'm just noting it down here. So maybe can you help me, Dr. Pooja, to get that email ID? I just lost that chat here.
I'll provide it.
Okay. Um, uh, Sorry, I missed the question in that.
The approach for teaching with research in mind, taxing students, and can there be a different approach to handle it?
So again, I need to understand because that's in complexity or in educational matters, there are no such common designs which can be prescribed to all. We have to see the question, resources, and the requirement, and accordingly we shape the project for that particular researcher.
Okay, thank you. We have 3 questions on the chat box and 1 hand raised. I'll go with the chat box first, and then Dr. Swapnil, I'll take your question. There's question from Dr. Ajay. How would complex model educational research help me in designing and implementing curriculum in my subject anatomy in the best interest of my undergraduate students?
So maybe you already have your undergraduate curriculum in hand. So you can plan an evaluation using a complexity framework on it. And I had shown one framework here. Keep all those stakeholders in mind and see that how do they receive your first cycle of intervention or the implementation that you have it. And then after each cycle of your evaluation, next time when you do the same evaluation, can you think of making that design little better and robust? This would be the better way of going ahead because you also learn in the process of program evaluation as you make it. So not to try something very big at the beginning, start small, learn from it, and then improve your rigor of your design as you make progress on that.
Thank you. We have a question from Dr. Chinmay Shah. If authorities are sensitive that funds will start, we will approach for CSR fund. Can you share international funding agency for MER?
I don't know. I'm looking forward to that response from you. And if you know, please let me know. Uh, there are some, I think there were some funding opportunities by AME sometimes on the educational research they have it in India.
Yes,
and for CSR funding, you are the best person to tell that from Gujarat. If you have any CSR interested, funding educational research is very critical, and you can argue on the point that that education is the best public health intervention, most cost-effective health intervention to bring about or improve the health of the people than direct provision of services through primary healthcare system. I mean, working through the system. So working through the educational institutions is important, and I'm sure you will do this work for us, sir. and bring some CSR funding for us.
Thank you so much. And I believe that we are looking forward towards Dr. Chinmay to help us out for the same.
Yes.
As far as AME funding is concerned, last year, one of the group of Indian faculties from Haryana Medical College, they received an AME grant, Aspire. They did receive an, so international grant, yes, it is available. There's one more question from Dr. Kiruba. Sir, what do you think the limitation of health professional education? Is it more theoretical or on paper?
Okay, as of now, uh, most of the, I say, education being a social science and complex, as I had mentioned earlier, we won't be having good evidence for most of the things that we do. Um, it's mostly the evidence that we get, we find problems with its implementation in practice. So I would say not 100% theoretical, but yes, we know more and practice little. So instead of calling it as theoretical, we would say this as the theory practice gap, which is rising day by day with large number of research and publications. So to bridge that, we need more practice oriented papers. That's what we need, papers which talks about change management stories, whether they success or fail. That would bridge the gap between theory and practice.
Thank you so much, sir. I'll take one more before coming up to Dr. Swapnil. There's one question which I would like to take. Dr. Anushri, what do you see as the next critical step in strengthening interprofessional collaboration within healthcare education research?
Yes, and when you go for complexity, that adds one of the agent to your the first component of your complexity. So it's not about students and teachers and the clinicians of the medical college, but it's all about including agents from other professions also in that. So that's most welcome when that happens and if that's needed for your project.
So, Dr. Swapnil, you can
Yes, madam.
unmute yourself.
I'm unmuted.
Yeah, please speak. You can ask
Yes,
your question.
yes. My question is about cynicism in medical education among various faculty and dispelling the fog which Harden talks about, that is prejudices, hunches, opinions, and guesses. And probably that we can do with presenting the best evidence. Now, where do we say is the source of the best evidence?
Hmm. So for we use that as of now we use AME guide, BEME guide, and we also have to start thinking about having that's what I was talking about, having our own dedicated journal in our country, and time to time best evidence we just refer to the AME guide, BEME guide. So we
Okay.
also need a platform for dissemination of our best educational practices for not others to follow as it is, but for others to learn from it and contextualize it when they implement it. There should not be any force on people to implement some
Yes.
blueprint or prescribed framework as it is. That won't work uh, because since it's a complexity, the nature is complex in nature, you might end up having some unwanted consequences, and quite often we don't measure them, so we think that they are not occurring and they happen. So to create, that's a very valid point, that to document our best practices we need a platform. So we have conferences, but we need a journals which documents these practices. That can be
And
the
just
that
I
can
wanted to, yeah. And in that if say but see thing, they say we have various contexts also, like private colleges, government colleges, aims like institutes. So always the context, we have different contexts in a one, a whole nation
Mm,
is not homogeneous, sort
mm,
of.
mm. And the context definition of context itself is quite broad. That takes into consideration the politics, the geography, the politics, the living culture, the people's expectation, the local epidemiology, the type of healthcare system. So imagine that within that one word, one letter of context, you have many agents and their interactions with it, make your things bit unpredictable that what will happen. So you can take the best precautions to get the desired outcome. And if not, then you in your next cycle you can improve that effort and try to get that desired outcome.
Thank you, Dr. Swapnil and Dr. Amol. I do agree what you were speaking right now for the question of Dr. Swapnil, that we need to have our own journal. And the reason why I'm saying that, I remember one of my article was not accepted in international journal, saying that it doesn't fit into our context of educational framework. So I had to come back to National Medical Journal of India, where it got finally published. The only thing is that, yes, we need to have specific educational journals, not a part of a journal having an educational research to be added up. I would like to take up one question Anshu Madam had written in the chat box. In the interest of all the attendees, can you please clarify when to use research and when to use evaluation design?
Hmm. So research is something when you want to test the hypothesis. If I take this from the biomedical science example, when you want to test the hypothesis and when you want to generalize the findings. And evaluation is done when you have some project or some activity going on and you want to check how well that activity is going on. And if it works, why it's working, and if it doesn't, then why it does not. And that's the thing. So research tend aim to have more generalizable finding. I would go a little beyond. There are many educational phenomena in educational settings. So we usually don't have an hypothesis as such, but we have for smart variables, but there are some phenomena which needs to be explained, like I would quote the trust building, the identity formation, how that thing happens, and that can be best explained by building theories which has analytic generalizability potential. So that also comes under research. So research aspires for generalizability, and evaluations tend to give you
context-specific findings mostly. Thank you. Thank you so much. There's one more question in the chat box. Venkatesh, Dr. Venkatesha.
Yeah, that's a good suggestion mentioned here on factors influencing evaluation for fixed curriculum development under regulated bodies versus autonomous institution. So is it an article that you are recommending us to refer or anything? Or is it a question or is it a suggested reading? So that I'm not clear here.
Hello.
You can unmute yourself.
Sir, I wanted to know the factors which keep influencing on this.
Okay.
Because a fixed curriculum in NMC which is prescribed, it has to be evaluated in a different manner, and an autonomous bodies will have a different parameters to chip in, and then they can get the evaluation done in a much flexible manner.
So we have to do a research on that. We have to study on that, because with just anticipation, I cannot say anything about it, but we need a research. That's a good research question that caught my eyes here. That if we take the examples of schools, for example, I had been to J. Krishnamurti school and tried to see how they shape their curriculum versus I have undergone my own schooling where we got exposed to the fixed curriculum, and we do the same thing here. So what's the difference? What will happen? So with anticipation, I would say that if we continuously or incrementally keep improving the curriculum, our curriculum will be appropriate for the generations that we deal with time. They don't get outdated. And perhaps if we continue to follow the fixed curriculum, that won't last longer, or there will be gap between people's expectations and what you teach them. So that's the reason why we need improvement. But that's a good research question. I think that can be studied.
Thank you so much, sir. Since we don't have any other question on the chat box and no hand raised, I have one more question in mind coming up. The question is that whenever we do an educational research in context to that of the healthcare system, won't it be good, specifically when we are doing in terms of education and curriculum, won't it be good to have the stakeholder, the schools, from where they come up? Because whenever we talk about the stakeholders, we talk about students. But students, why I'm talking about, because I'm from a faculty who teach first year medical students. They just come up from a transitional phase of school to college. So they have many, many issues. And not only academic part I'm talking, it's something beyond the academic part. So as a stakeholder, shouldn't the school also be one of the stakeholders? And if we would like to take it, how to proceed for it as an educational research?
Say, when we say that students come with their personal identity to the medical school, and as they get socialized in the school environment, and then they become part of that community of practice as they do their course, and their identity gets transformed. So that should be studied. I mean, if you are doing study on what kind of identity do they enter within medical school, and then you longitudinally follow them up over the period, a kind of doing an ethnographic research longitudinally to see how their identity gets shaped. In that case, you certainly need some measurement, but would say that you can see this journey or measure or study this journey from their personal identity when they join the school versus their identity at the time of graduation, what transformation has taken place. So that fits very well into this kind of complexity analysis because it's more adaptive, transformative, and evolving in nature. Uh, the phenomena is evolving in nature, which you measure by using longitudinal design, by doing measurements over a longer period of time, not just at the entry level, but uh, at the subsequent level. While I was reviewing literature for my PhD in India or across the globe, we find very little studies on um, uh, entry level identity formation. I mean, entry level identity. I was looking it in the context of public health. Maybe there could be some studies on the medical education, which you may look for, review if you come across.
Sure. Thank you so much. I don't think we have any more question on the chat box or any hand raised. No, we don't have any other. So can you just summarize your talk with a focus on as a take-home message, that what one should, as a thought to be processed from evaluating educational research or a curriculum or doing a research study for the same, which would be beneficial for the attendees as well as others who will be watching it on the YouTube on a long-term basis, and which probably the outcome of which might provide an opportunity for change.
So the first point that I would say is that education, and would extend if there are people from public health background here also. So education and public health both is complex system. So studying them with just one set of methods is not enough. You might need use of multiple methods, and studying them just at one time is not enough. You might need to measure them longitudinally over the period of time. Third, you have to anticipate that in addition to your intervention, in addition to the benefits that you envision for your intervention, there will be some undesired outcomes. So not to get panicked about it, but to have a plan that how you learn and manage it as you go further on that. So evidence generation and incremental improvement in the system will make your system more time relevant. So flexible systems and soft systems tend to survive with time. So that's one thing. And the last thing that evidence, your journey should not stop with the evidence generation. It should rather start from there, that we know that this works. So let me continue my journey on that. So do more activities that benefits to the students in your educational settings as you go for it. The focus is too much on studying only one component of curriculum. We need research on other components of curriculum, such as assessment, student support system, educational environment, faculty development. We need to focus on other stakeholders, like the other agents like postgraduate interns and faculties. And one of our colleague was saying, talking also about interprofessional colleagues, colleagues from other professions if they join your project on that, in that settings. And yes, we need to value educational research, not some secondary or second class research to be done by faculties who don't have time, who don't have other work to do. This is a very, very important task, perhaps the primary responsibility of an educator. Apart from studying their subject, educational research should be the primary responsibility of every educators who have interest in this field. So this would be my key take home message, and also looking forward to the funding opportunities and the platform for publishing educational research in future in India.
Thank you so much. Thanks a lot, Dr. Amol. We don't have only attendees from India, but we have from Indonesia, from Nepal, and as well as from Pakistan. We are thankful to all the participants to be a part of this webinar. And thank you, Dr. Amol, for such a wonderful session. And thanks for clarifying all the majority of the queries which came up to our mind. To have a better understanding about what exactly the educational research and program evaluation for an educational project can be. So thank you so much. And
Thank you.
Thank you all. And thanks to all the attendees for being a part of here. You can also have a recorded video of this webinar on the YouTube. It's PU webinar is the link from the YouTube.
Just writing my email in the chat box here. If they have any question unaddressed, they can write to me. It's there in the chat box now. Feel free to write questions and I'll take time to respond. With some study and research, I will respond to your questions.
Yeah, I'm attaching the YouTube link. This is the YouTube link. Thank you everyone for being part of this webinar. You may leave the webinar.
Thank you. Thank you.
Thank you so much, sir. Thanks a lot. Thank you so much. Have a great day and looking forward for you all to join the next webinar, which will be on 6th of Feb. We'll be sharing the Zoom link once the flyer is done. And thanks for being part of this webinar through and through and having more collaboration. We are open for the collaborative work with you all so that we can have a bigger research outcome. Thank you so much. I'll be ending the webinar.